know why it keeps opening up. Okay, so I also looked at sexual problems in people with spinal cord injury. I used the same participants for the study. And again, as I previously mentioned, spinal cord injury is a chronic disability that affects all domains of life. I think what's important here is that spinal cord injury disrupts motor, sensory, and autonomic pathways. And depending on the level of injury, sexuality can also be affected. I think what's important to highlight here is that sexuality is an important aspect of human life. It encompasses of sexual activity, gender identity, sexual orientation, intimacy, as well as the ability to reproduce. Sexual problems include altered sexual desire, arousal, pain, and erectile dysfunction, which had also come up quite a bit in my interviews. Sexual problems affect both relationships as well as participants' self-image. And these have also been alluded to in some previous studies as well. And managing sexual problems is challenging for people with spinal cord injury because at times they've mentioned that it either doesn't work or it's just too costly for them. So in terms of my problem statement, studies looking at the complications experienced by people with spinal cord injury, again, are mostly based in urban settings. And looking at the fact that spinal cord injury affects mostly young men, conversations on sexual problems and long-term care needs is limited. The aim of the study was again to explore the experience of sexual problems and long-term care needs amongst people with spinal cord injury. As mentioned, it's part of the same study, so the methodology was pretty much the same. And I'm showing the exact same results. So just my demographic data that most of my participants were male. Most of the participants were unemployed as well. Only 2 of the participants were married. And then just in terms of the spinal cord injury profile, again, most of them, the cause of injury was traumatic. 92% of them were paraplegic. And a large number of my participants, 92% of them experienced pain. The main theme that emerged from sexual problems was dissatisfaction. The types of sexual problems that came up from the analysis was no satisfaction, low drive, as well as erectile dysfunction. And the factors influencing sexuality, things like secondary complications, pain, pressure sores, and contractures. This was one of the quotes that had come up from one of the interviews. Then their perception of disability and how it also affects the perception of themselves. And lack of information. The impact of sexual problems. So sexual problems affected the participants' mental health, their relationships, and self-image. And again, these were just some quotes that I thought were beautiful that came from my analysis. In terms of management of sexual problems, what had come up from the analysis was the strategies that participants had used to manage their sexual problems. And these included medication of some sort, generally just ignoring their sexual feelings, It was interesting. One participant mentioned that eating cheese helped him and managing bowel and bladder first before having sexual intercourse. And these were just, again, some quotations from my analysis as well. In terms of their long-term care needs, the things that were really highlighted were medication as well as information. So just to wrap up, the impact of sexual problems on intimate relationships and perceptions of health, of self, were definitely highlighted in some studies that I've also read. Male participants in particular worried that their partners would leave them if they do not satisfy them sexually. Female participants neglected their sexual health. I only had 2 female participants in the study, and they were generally very reluctant to talk about their sexual health. A lot of them saying that they've kind of just gotten used to not being intimate with the partner and that they had other things to worry about. So worrying about their sexual health wasn't a big deal for them. And I think that conversations around sexual health are important to assist people with spinal cord injury to openly discuss their challenges and needs. And 2 key messages to take from this is not only the conversation around sexual activity, but the conversation must also be broad to include things like fertility, safety around sexual activity, so addressing things like STIs as well, and just sexual activity in general. And then the importance of healthcare professionals and being trained to address sexual activity. And I think that part of why we don't do it as healthcare professionals could possibly be because we don't know how to address this. And basically just the importance for me, the real thing that was highlighted was understanding the experiences of people with spinal cord injury to help inform interventions related to their sexuality. And just as a recommendation, peer support and education on sexuality, which should also include pain management, as some participants had mentioned that it's actually painful, especially the one participant who mentioned that he had a sore on his penis. And what I liked about them mentioning peer support, which is a beautiful initiative that's run in Manguzi, the team really do amazing work. What was nice to hear from the participants themselves was that they felt open enough to discuss their challenges and their problems, what works, what doesn't work, almost comparing notes with people who are similar to them. And I think that that's something that we also need to take into consideration if it is that as healthcare professionals, we're trying to get buy-in from our patients. One person in particular mentioned that we love the information and the input that we get from you guys as healthcare professionals. But sometimes it's difficult because you don't walk a day in my shoes, you don't fully understand my challenges. So when I can speak to someone who goes through what I go through, it sometimes is easier because I feel like they can relate to me more. So I think that that's also just a nice take-home message. But thank you so much.
Thank you very much, Lauren. Just stay online. I just want to see if there's any comments or questions from any participants online.
Lauren, the online comments, I don't know, can you hear us?
I can hear you, yes.
Okay, well, Lauren can, but can the audience here in the venue hear us?
Yes, we can.
Okay, so the online comments, where there's a lot of people commenting about it was very important to hear the first-hand experiences, that it was very insightful. they were interested about the short lifespan of the condom catheters, and that we really need to look at what we're supplying to patients to make sure that they're of a reasonable quality. And then the two questions, actually they're both my questions, was basically, has anything changed at Manguzi because you did the study?
I guess that's me answering. I see the first question was, is there a sexual health education program at Manguzi? We started the year before Lauren with our first workshop around sexual reproductive health, but it was to get some group cohesion as well, and to get people unpacking, you know, it was like the precursor. It wasn't what Lauren did. So it was a good start. And then having Lauren there for that workshop was really amazing. During that time, we've also, or between our first precursor workshop and Lauren's intervention, we'd also started really building and strengthening our peer support program, which then helps get people together, get people knowing each other, get the networks going, get the structures and organization and stuff in place. And we'd also made links with the first urologist based at Ngwelezan, which is our tertiary hospital 3.5 hours away. So a lot needs to be put in place first. It doesn't just automatically happen. We are very much looking forward to continuing this type of intervention. I think group interventions work very well. Getting participants to the groups, you know, because the prevalence of SCI is quite low, people are very scattered. So it's not like you could run a group at a clinic. It would have to be at the hospital. And for certain people, like just a single trip to hospital is very financially unaffordable. But I think that there was so much positive feedback from this workshop that perhaps if you did it, you know, once a year or twice a year, people would actually be willing to do it, to pay. So yes, there is plans to continue doing it. With regards to the urology services, we have not had a urologist forever. And 2020 was the first time that we actually got a urologist based at Ngwelezan. There's now 2. So now there is a potential to actually start sending people for urology services. There was not an option previously. With regards to the consumables that are of low quality, it's not just low quality, but it's also the sizes that are not available on tender, which requires you to buy out of tender, and that's where the quality issues come through. And then, yeah, a lack of disability sensitization, etc., at higher levels, including cross-like stores financing and stuff, which the study is really helping to address. So, Lauren, I just want to say, like, amazing study, super helpful results, both for a grassroots Manguzi perspective, but also for an advocacy perspective and informing policy budget holders, etc.
Thank you. Mareka, can I just add to everything that you've said? Pretty much made sure I did my research, but you've covered all my bases. I just wanted to say that the second part of my study, I also had interviews, well, questionnaires, outcome measures that I gave my participants. And to answer the question as to whether there's been a difference, just from administering my outcome measure before intervention and 6 weeks post-intervention, I can definitely say that yes, there has been a difference. I looked at both quality of life and mental health in patients with spinal cord injury. So those are my outcome measures, and the tools that I used were the SF12 and the World Quality of Life, the World Health Organization Quality of Life questionnaire. And both of them showed a difference in both pre and post-intervention. Some marginally, and some there was quite a big difference in them. But overall, the scores, both pre and post, did show that the intervention was beneficial. I've loved the
Challenge
study.
will- The
And
challenge will
I-
obviously be, sorry.
No
And the
problem.
challenge will obviously be to make sure that we actually have the consumables to give them and the service to offer them now that the workshop has been done.
100%. And I think what has definitely informed me doing a study like this was I've always been very passionate about trying to see where it is that we can push policy in terms of healthcare professionals. I think sometimes we feel like there's so much red tape, and I just thought that this would be a nice way to try and help and inform those kind of decisions, even if it's just one small study.
Excellent study. Thank you so much for doing it. And please, you and Santi must continue to keep up the good work. We look
Thank
forward
you.
to seeing you soon.
Thank you. Anyone from the audience here? There's a comment, question for Lauren? Nope. So yeah, Lauren, I just want to wish you well with your studies further. And thank you for your presentation.
Thank you.